Welcome to this installment of Morning Report Emergency Medicine. I'm Alec Weir. This is the case of, do you have blurred vision, a headache, chest pain, blurred vision, headache, chest pain, blurred vision, headache, chest pain? Some of you may already know where I'm going with this. It's a 52-year-old female with a past medical history of hypertension. She's presenting with blurred vision over the last 4 weeks. On the left, worse than the right. Initially responsive to corrective lenses, but now has worsened. And she's been offered blood pressure medication for over 8 years. Her vitals, temperature looks good, heart rate's fine, blood pressure 269 over 139. Sadly, not the worst blood pressure I've seen at our hospital, but incredibly hypertensive, right? Respiratory rate's 18, satting well on room air. On our physical exam, I've highlighted the important thing for you. On the left, her vision is 20/40, the affected eye. On the right, looks good, 20/20. And then fundoscopic exam, positive for retinal hemorrhages on the left. The right eye looks good. So what are we seeing here? So this was done with our panoptic scope. We have our optic disc here. This is artifact from your panoptic. And then highlighted with arrows, this is our retinal, this is our hemorrhage, okay? You can see it out here in the periphery, multiple locations. So here's our resident plan. Cardiac monitoring, pulse oximetry, EKG was done, looking for other signs of end organ damage because of this hypertension. And then, rightly so, we'll need admission for hypertension with end organ damage. An ophthalmology consult was placed in the emergency department. On the right, the cup to disc ratio was 0.3, which is normal. Shunt vessels, the macula is within normal limits. There is severe AV nicking and tortuous vessels, but the periphery looks good. And then on the left, the area where the patient's having the most complaints, the cup to disc ratio is again normal, with a pink, healthy appearing rim. The macula with diffuse dot blot hemorrhages, that's DBH, AV nicking, tortuous vessels, and the periphery also has scattered dot blot hemorrhages in all quadrants. So the final call is hypertensive retinopathy in both eyes with a central retinal vein occlusion on the left. Hypertensive retinopathy accounts for only about 1% of your hypertensive emergencies, and we do have a grading system. You can see it here. Our patient fell into grade 3, arterial narrowing with retinal hemorrhages and or exudates. We didn't quite make it to grade 4 because we had a nice crisp optic disc on the left. And that central retinal vein occlusion, what is that? It's that blood and thunder picture that we have with those retinal hemorrhages. It's a painless vision change, can be either ischemic or non-ischemic. Your differential diagnosis includes hypertension, diabetes, hyperviscosity syndromes, and things that can cause papilledema. And despite your differential being mainly systemic diseases, CRVOs are usually unilateral. And again, here's our left fundoscopic exam, and we have this nice crisp optic disc, so we're not to grade 4 hypertensive retinopathy. You can see some severe AV nicking here, and then again, highlighted by some arrows, is our hemorrhage. Hospital stay. Creatinine was 2.2. We don't have any old to compare it to. Was admitted to the cardiac ICU on a sodium nitroprusside drip with a plan for a 20% drop in mean arterial pressure. Transitioned to oral BP meds prior to discharge. So what are our take-home points? Blurred vision can be real, and it can be subtle. All right, our patient only had a 20/40 on the left when compared to 20/20 on the right. So in your hypertensive patients with those vision complaints, you got to do a fundoscopic exam. And beware of hypertensive retinopathy and the grading system that goes along with it. And it only accounts for 1% of hypertensive emergencies, but in the case of this patient, it sealed the deal for that admission and for that ICU nitroprusside drip. And your central retinal vein occlusions, that's that blood and thunder picture that we saw, usually unilateral despite your underlying causes being more systemic diseases. All right, guys, that's it for this week. I'm on vacation next week, so unfortunately you'll have to go a week without morning report. But again, keep your eyes open for those interesting cases.